Greetings to all of you. I am Dr. John Grifson, surgical gastroenterologist and advanced laparoscopic surgeon from Nagarkoil. We are running a center called as John Gastro Hospital in Nagarkoil. Today we are going to talk about hernia. So what is hernia? Hernia is an abnormal protrusion of the contents inside the abdomen through a defect in the cavity, in the wall that is containing the abdomen. That means there are several layers which is forming the abdominal cavity and which is protecting the bowel from coming outside. So when there is a defect in the layer, the bowel or the contents inside the abdomen bulges out through the abdomen. That is called as hernia. Okay, why does it happen? Now, many of you may have a doubt that some of you may be very strong or physically very fit, but still you may develop a bulge or a hernia, and you may have a doubt, why does it happen to me? So there are several reasons why this hernias occur. At parts in the abdomen, there are actually congenital spaces that are weak, inherently weak. So that spaces, when they remain open or when they fail to close in the appropriate time, that results in congenital hernia. That means the hernias that are present since the time of birth. So usually if you see small children, they may have bulge in the umbilicus or in the inguinal region. So these are congenital hernias. That means the natural passages or the natural openings have not closed and they have remained open, through which the bowel is protruding outside. Okay, in a normal adult, why does a hernia happen? So it may be either due to the inherent weakness in the structure of the muscle, maybe due to some collagen abnormality, maybe due to smoking habit, or may be due to other reasons, like patients may have a chronic cough, or they may be continuously straining, so which is weakening a portion of the muscle, and that eventually gives away and leads to a defect through which the bowel bulges. So it may be related to several of these factors, like an elderly male can have a prostate, benign prostatic hypertrophy, and that can result in obstructed urination, and when he continues to strain during urination, can develop a hernia. So these are some of the common causes of hernia. Okay, let's now see what are the symptoms that occur when a hernia develops. The hernia itself means that it is obviously a bulge that happens in a part of the abdomen. So if it comes through the inguinal region, which is the most common thing in men, it is called the inguinal hernia. And in that particular case, the patient may have a vague pain or a swelling that appears and then disappears. So typically if you see a hernia will usually appear when you strain or when you exert, and it disappears when you lie down or when you relax down. So that is the typical initial symptom that you can see in a hernia. And then the patients may have some pain or prickling sensation, and depending on the complications that evolve, like say if there is a strangulation or obstruction of the bowel, then they may have diffuse abdominal pain, vomiting and constipation and other symptoms thereof. So let us see how to get cured from this hernia. So hernias traditionally used to be cured by open operations. Open operation meaning a cut is made over the region of the hernia, and then surgery is made, either suturing or later a mesh repair technique came in, where they called as a tension-free mesh repair, and that used to be the traditional surgical technique. So of late, what are the treatment techniques? The most advances that have come today are in the form of laparoscopy or keyhole surgery. So what do you mean by keyhole surgery? Keyhole surgery means small incisions or cuts or made in the abdomen, through which small instruments and camera are placed inside, and the surgical repair is done from inside the abdomen. So there is no obvious or big scar outside. The wound healing is very rapid, bleeding is very less, and patients are able to get up and move very easily, and you can get back to your work as quickly as possible. So these are the latest techniques of the hernia repair. So some of you can ask you, does hernia really need a surgery? Can I wait, or do I need to really operate? Well, it depends upon the type of hernia and the size of hernia and the problems you have. See, if you really have a problem, then always you have to get operated. A direct hernia that occurs in elderly age, a small bulge, can be managed, but usually I think a good surgeon should be able to decide if you want to wait on a hernia. So by and large, the treatment of hernia is surgical, and you usually get a very good relief with a laparoscopic surgery. Thank you very much for your patience.